A 15-year-old books an appointment with a primary care provider, and in the appointment, the patient shares that they are sexually active and want to have an STD test performed. The results come back, and the patient is tested positive for chlamydia. As the provider, do you call the patient's parents and share the results? After all, the patient is a minor. In today's episode of Banner Health's Making the Rounds, we're talking about confidentiality of adolescent healthcare, the rights and guidelines, and how practices can create safe environments for adolescents to receive care. With me today is Dr. Jennifer Nelson, internal medicine pediatrics physician at Banner University Medical Center Internal Medicine Clinic and University of Arizona Clinical Assistant Professor of Medicine. Thank you, Dr. Nelson, for joining us today.
Thank you for having me. I'm excited to be here.
Dr. Nelson, could you help set the stage for our listeners and explain specifically the rights and guidelines that are in place for adolescent healthcare in Arizona?
I'd be happy to. Adolescents in the state of Arizona have a unique set of rights that many patients don't know about. In Arizona, adolescents are generally defined as those ages 12 to 18. As providers, informing our adolescent patients about their rights should be part of our regular conversation. I'll also note that these rights are my understanding as of today, July 2022, but are always subject to change. In the state of Arizona, adolescents have the right to health care with the expectation that they will be treated with respect, given honest answers, have access to their medical records, and ask questions to understand their insurance and billing. They also should know that they have the right to talk to a healthcare provider alone, without a parent or guardian, and the expectation that their discussion will remain confidential, except for disclosures where there is concern an adult is hurting them, there is suicidal or homicidal ideation, the minor has had sexual contact with someone age 18 or older, or the minor has had sexual contact with someone age 13 or younger. This does not apply to two people ages age 14 to 17 engaging in consensual sexual contact, though. Some of that can be confusing for our adolescent patients, so I typically say something along the lines of, everything we talk about today is confidential unless I'm concerned you're being hurt or you're at risk for hurting yourself or someone else. I also always tell them that if we get to something like that, I'll let you know. Additionally, without a parent or guardian permission, adolescents have the right to consent for testing for sexually transmitted infections and HIV and treatment for all sexually transmitted infections except for HIV. Many teens are surprised by this. Teens are also eligible to receive emergency services when a parent or guardian cannot be reached. So I also always remind them that if they are ever in danger, they can and should seek help. They can receive treatment for substance abuse. However, if they require admission, a parent will be notified, and also for sexual assault if they're above the age of 12 and if a parent or guardian cannot be contacted in the appropriate time frame. Additionally, most minors can consent for contraception and family planning services, emergency contraception, pregnancy, and prenatal care.
Can you describe why adolescents might want their appointment to be private and unknown to their parents or guardians?
During adolescence and until about the age of 25, the prefrontal cortex is in development. This is the part of the brain that's responsible for complex decision making. Additionally, located here is our limbic system, which is our reward center. During adolescence, this limbic system is super active, and as a result, our teens are seeking new and exciting experiences. Depending on the scenario, the adolescent may not know how their parent would feel about them engaging in these behaviors or what the outcomes might be if they find out. They may want to talk about them privately and may be more likely to freely discuss without a parent around. Additionally, adolescence is a time when our teens are developing a growing sense of autonomy, and having time to confidentially discuss their healthcare or know that they can consent for certain parts of their healthcare helps grow that autonomy.
Thank you, Dr. Nelson. When we talk about adolescents, what is the age group that we're referring to?
So in the state of Arizona, generally adolescents are defined as those ages 12 to 18.
When we talk about these confidential conversations and appointments, this differentiates from a normal healthcare visit, such as strep or I have an ear infection. These types of appointments that we're referring to are more of health and wellness and mental well-being. Is that correct?
So absolutely, you're correct. So if a patient came in for treatment for strep throat, they would absolutely need a parent's consent before they could be seen, tested, or treated. These scenarios are very specific to the ones I described above. That would be sexually transmitted infection, testing and treatment, HIV testing, emergency services, substance abuse treatment, and then sexual assault if they met the criteria. And then most minors can also be seen for those family planning services we talked about without their parent or guardian as well. But for all other things, urinary tract infections, colds, cough, strep throat, a parent or guardian needs to be present.
There are a lot of barriers and elements that make a healthcare appointment completely confidential for a young child. So, such as navigating insurance, appointment reminders, lab results, and other follow-up. This is difficult for us as adults to navigate the healthcare system. Can you tell us a little bit about some of these barriers when it comes to our adolescents?
Absolutely. So, maintaining confidentiality starts before an adolescent even comes into the clinic. It can really begin with the scheduling team and making sure that they're educated on what services adolescents can access without parental consent confidentially. And each healthcare system has different capabilities, but there may be options for sending appointment reminders to different people depending on the nature of the appointment made, and allowing the team to choose whom the reminder goes to when it's regarding a confidential service.
Do our adolescents have access to their own medical records? Are they able to create their own patient portal?
Yeah, they have a right to have access to their own medical records. Each healthcare system is different with regards to the portal and whether or not a adolescent has access to it or whether or not an adolescent can opt in or out for their parent to have access to it.
How about when a patient is physically in the office?
When the patient is physically in the office, there are a number of things clinics can do to create a safe and confidential atmosphere for our teens. Things such as creating a psychosocial screening form that targets all the typical questions you would ask during a heads exam, and creating a way for the adolescent to fill these out in private and then give them to the provider privately can be one way. Making it part of our routine practice to discuss during adolescent wellness exams or pertinent sick visits that the provider spends time with the adolescent without a parent or guardian and during that time reminds them of their rights. And then for some systems, creating confidential note types or ways to limit access to patient portals can help our adolescents know that their conversations and care is truly confidential.
Dr. Nelson, can you speak a bit about navigating confidentiality in billing?
So, one of the things to note as providers and to also help our teens navigate is that consent doesn't necessarily equal confidentiality. So, while we may do our very best to keep conversations and plans regarding sensitive diagnoses confidential, there are other parts of healthcare that may not. For example, just because a teen can come to your office to seek testing and treatment for STIs alone, it's important to explain to them that if they are still covered by their parent's insurance, their parent may still receive an EOB or explanation of benefits, which may describe that they were in the office for a visit, and they may even receive a bill from the lab with even more details. There are coding types that we as providers can use that may make a visit reason less obvious. However, ultimately, there's no guarantee of confidentiality once beyond the physician's office. This is all the more reason why we as providers should always encourage our teens to discuss their health care with their parents. In follow up to these types of visits, it's also good practice to ask the adolescent for a good contact number. Document that somewhere in the chart and be sure if you're tasking your staff to call results that you clearly note that this needs to be discussed with the adolescent directly and not the parent.
When we talk about confidentiality, more than just adolescent healthcare, some of these practices can be implemented to give adult patients confidentiality from their family members as well. Dr. Nelson, we've discussed the details of adolescent confidentiality in healthcare, but why is this important and how do we continue to navigate this relationship between an adolescent patient and their provider?
All of these measures really help our adolescents know that we're their partner in their healthcare. We value their rights and we respect them as adolescents as they move into adulthood. The more our patients trust us, particularly our adolescent patients, the more likely they are to continue to seek care, to trust the healthcare system, and to come back to us when they have questions about their health instead of seeking information in less trusted sources.
Dr. Nelson, this has been really an informative discussion and some great takeaways for our clinicians to help create a confidential space and teach young adults that they can trust in their healthcare provider and that relationship is ongoing and that they can maintain that quality care in areas of need.
Thank you so much for having me on today. I'm really excited to be talking about this. This actually is a really important topic to me because here at the Banner University Medical Center Internal Medicine Clinic, we have been embarking on an 18-month-long quality improvement project through the Arizona Family Health Partnership and the Arizona Alliance for Adolescent Health to improve our care and access to health care for our adolescent patients.
That is some very wonderful work. And thank you for sharing your time and expertise on these complex, important, but ever changing topics. Our listeners can learn more about Dr. Jennifer Nelson and healthcare services provided at Banner Health by visiting bannerhealth.com. Thank you for listening to this month's episode of Making the Rounds.